Temporomandibular Joint Disorders, TMJ. The temporomandibular joint, TMJ, acts like a sliding hinge, connecting your jawbone to your skull. You have one joint on each side of your jaw. Temporomandibular Joint Disorders, TMJ, a type of temporomandibular disorder or TMD. It can cause pain in your jaw joint and in the muscles that control jaw movement. The exact cause of a person's temporomandibular joint disorders, TMJ, is often difficult to determine. Your pain may be due to a combination of factors, such as genetics, arthritis or jaw injury. Some people who have jaw pain also tend to clench or grind their teeth, bruxism. However, many people habitually clench or grind their teeth and never develop TMJ disorders. In most cases, the pain and discomfort associated with TMJ disorders is temporary, and may be in remission when self-managed care or non-surgical treatment. Surgery is typically a last resort after conservative measures have failed. But some people with TMJ disorders may benefit from surgical treatments. Causes of temporomandibular joint disorders. The temporomandibular joint combines a hinge action with sliding motions. The parts of the bones that interact in the joint are covered with cartilage and are separated by a small shock-absorbing disc, which normally keeps the movement smooth. Painful TMJ disorders can occur if the disc erodes or moves out of its proper alignment. The joint's cartilage is damaged by arthritis. Also, the joint is damaged by a blow or other impact. In many cases, however, the cause of TMJ disorders isn't clear. Symptoms of temporomandibular joint disorders. Signs and symptoms of TMJ disorders may include aching pain in and around your ear, aching facial pain, difficulty chewing or pain while chewing, locking of the joint, making it difficult to open or close your mouth, pain or tenderness of your jaw, pain in one or both of the temporomandibular joints. TMJ disorders can also cause a clicking sound or grating sensation when you open your mouth or chew. In particular, if there's no pain or limitation of movement associated with your jaw clicking. To greater than, you probably don't need treatment for a TMJ disorder. Temporomandibular joint disorders, TMJ, when to see a doctor. Seek medical attention when you have persistent pain or tenderness in your jaw, or when you can't open or close your jaw completely. Your doctor, your dentist or a TMJ specialist can discuss possible causes and treatments for your problem. Risk factors of temporomandibular joint disorders. Factors that may increase the risk of developing TMJ disorders include jaw injury, long-term, chronic, grinding or clenching of teeth, various types of arthritis, such as rheumatoid arthritis and osteoarthritis, certain connective tissue diseases that cause problems that may affect the temporomandibular joint. Treatment of TMJ disorder. In some cases, the symptoms of TMJ disorders may go away without treatment. In particular, if your symptoms persist, your doctor may recommend a variety of treatment options, and often more than one to be done at the same time. Medications for temporomandibular joint disorders. Along with other non-surgical treatments, these medication options may help relieve the pain associated with TMJ disorders. Pain relievers and anti-inflammatories. When over-the-counter pain medications aren't enough to relieve TMJ pain, your doctor or dentist may prescribe stronger pain relievers for a limited time, such as prescription-strength ibuprofen. Tricyclic antidepressants. These medications, such as amitriptyline, are used mostly for depression. But in low doses, they're sometimes used for pain relief, bruxism control and sleeplessness. Muscle relaxants. These types of drugs are sometimes used for a few days or weeks to help relieve pain caused by TMJ disorders created by muscle spasms. Therapies for temporomandibular joint disorders. Non-drug therapies for TMJ disorders include oral splints or mouth guards, occlusal appliances. Often, people with jaw pain will benefit from wearing a soft or firm device inserted over their teeth. However, the reasons why these devices are beneficial are not well understood. Physical therapy. Along with exercises to stretch and strengthen jaw muscles. Treatments might include ultrasound, moist heat and ice. Counseling. Education and counseling can help you understand the factors and behaviors that may aggravate your pain, so you can avoid them. Examples include teeth clenching or grinding, leaning on your chin, or biting fingernails. Surgical or other procedures. When other methods don't help, your doctor might suggest procedures such as 1. Arthrocentesis. Arthrocentesis is a minimally invasive procedure that involves to greater than insert a small needle into the joint so the liquid can be watered through the joint. To greater than then, remove the debris and inflammatory byproducts. 2. Injections. In some people, corticosteroid injections into the joint may be helpful. But infrequently, injecting botulinum toxin type A, Botox, others, into the jaw muscles used for chewing may relieve pain associated with TMJ disorders. 3. TMJ arthroscopy. In some cases, arthroscopic surgery can be as effective for treating various types of TMJ disorders as open joint surgery. A small thin tube, cannula, is placed into the joint space. An arthroscope is then inserted and small surgical instruments are used for surgery. TMJ arthroscopy has fewer risks and complications than open joint surgery does. But it has some limitations as well. 4. Modified condylotomy. Modified condylotomy, condylotomy, addresses the TMJ indirectly, with surgery on the mandible, but not in the joint itself. It may be helpful for treatment of pain and if locking is experienced. 5. Open joint surgery. When your jaw pain does not resolve with more conservative treatments, and it appears to be caused by a structural problem in the joint, your doctor or dentist may suggest open joint surgery, arthrotomy, to repair or replace the joint. However, open joint surgery involves more risks than other procedures do, and should be considered very carefully, after discussing the pros and cons. In particular, if your doctor recommends surgery or other procedures, be sure to discuss the potential benefits and risks. At the same time, ask what all your options are. Note: diagnosis and treatment of TMJ disorder will help solve pain-related problems in your face, jaw area and ear area. Any symptoms caused by the disease can be both physically and mentally uncomfortable and especially life-threatening. The goal is to solve your problem. So be open and ready to experiment. At the same time, choose your strategy, take action and start enjoying the benefits. Reference: Free solution for TMJ disorders. Link in the description. Or refer to 247naturalhealth.com to all information about chronic disease. In particular, if you know Qigong and its miraculous improvements to health, visit falundafa.org. Thank you. I hope you are always happy and healthy. Thanks for watching. Don't forget to subscribe to the channel to receive useful information.